allow me to introduce Dr. Enkhzaya
Yes, correct.
Ganbold. She is an international medical graduate where she specialized in cancer genomics. She has been working in higher education administration for over a decade. She is a final year DBA doctoral candidate, and her research area is data analytics in the healthcare sector. Zaya is the winner of the Best Education Presentation in SyBER 2022, a symposium organized by Westcliff University. The presentation is the impact of health information on technology and AI in a physician's workload.
Okay, hello everyone. It's a pleasure to participate for this symposium, and let me share my screen. Okay, hold on one second. Okay, can you see my screen?
Yes,
Okay, wonderful. All right. Hello, everyone. My name is Zaya, and I'm the DBA candidate at Westcliff University. And my presentation title is The Impact of Health Information Technology and Artificial Intelligence on Physicians' Workload. Here is the agenda. And when I move to the next slide, let me a little bit explain about why did I choose this topic. For myself, I'm a physician in my home country. And when I used to work in the medical sector, I noticed that there are a lot of paperwork while doing the examination, working in the health industry. And I was wondering that, is there any way to make it shorter, to shorten the time to do the paperwork? And we were expecting a high result shifting to the electronic health records. However, the time that we spend on the paperwork, it's just like shifted to the electronic forms. There was not that much improvement. And then when I moved to the United States, I was wondering, how is the United States health sector? How are they handling this problem? And when I go to the physician, like as a customer, as a patient, I felt a little bit disappointed because I wait for like more than a month to wait for the appointment. And when I see the physician, it was only like 10 minutes, 15 minutes after waiting for over a month. So seems like regardless of which country you are, the situation is almost similar. So that's why I wanted to combine my medical background and my current study, data science, to combining together how to solve this problem. So the problem background is the physicians have a small amount of time on a physical examination in talking with the patient, but spending numerous hours on the paperwork. The average time to spend with each patient is 17 to 24 minutes, which leads to dissatisfaction among patients. So the problem statement is physicians, they prefer more direct contact time with the patients. And it helps with work satisfaction for physicians as well. The risk of a malpractice claims is linked to the visit length. The less spending time with the patient causes a higher number of malpractice claims. And there is a lack of studies on the link between information technology, artificial intelligence, and a physician's workload. The previous studies mostly identified the overloaded paperwork in office hours among physicians, and mostly it was conducted about 10 years ago. The purpose of the study, this is a qualitative study with a grounded theory, and it will describe the impact of a computer-based systems on physicians in the clinical field and how artificial intelligence can contribute to this gap. The study will reveal the elements of the computer-based system supporting physicians' performance and what improvements, including AI involvements, are necessary in order to meet the user requirement or improve physicians' work performance based on a one-on-one interview. Under the conceptual framework, assume that the grounded theory can be a good fit for this research because there is no current theory, assumption, or prediction that explains the situation of the phenomena. So the theory will be revealed at the end of the research. So there are two research questions. The first question has two sub-questions. So research question number 1 is, to what extent do computer-based systems impact physicians' workloads? Sub-question 1 is, what is the impact of a computer-based systems on physicians' daily workload? Sub-question 2, what is the link between computer-based systems and a physician's performance? The research question 2 is, how AI-driven technology can affect physicians' workload? The nature of the study. So the research method, as I mentioned before, it is a qualitative study with a grounded theory research design. And the data collection is one-on-one in-depth interview. And I decided to use the Zoom online platform to broaden up the participants who can join from the different states. The target population is it has to be physicians who practice in the United States and who uses the computer programs on a daily basis. In a data analysis, I chose MaxQDA, which is specifically dedicated for the qualitative studies. It's a software, and the data coding is automated, and it will be faster, and it has less error compared to the doing things in a manually. Significance of the study. Understanding the current problem that we use electronic health records and the other information technology programs. So how it is affecting, is it efficient in today's healthcare sector or not? And find an efficient way of a computer-based program and an AI usage that will affect and reducing the overloaded paperwork. So it will be beneficial for program developers, and this research work will give an idea, some practical suggestions, ideas, and solutions for from the user perspective, which is the physicians. And for hospital and health sector decision makers, health policy developers, it will give an idea of planning, revising, and reevaluating the current policies. And also, this study will help to reduce the paperwork and administrative hours. It can be helpful in a work dissatisfaction and a burnout among physicians in the clinical field. And also, spending more time with the patients will help to reduce the malpractice for physicians. My assumptions? Well, basically, there is no assumption because it's a grounded theory. So, that's the reason I chose this grounded theory study. And at the end of the research, the theory will be developed based on the empirical data that is deeply grounded and the participants' experience reflects in it. As a researcher, the assumption of the study is the participants will respond honestly because their confidentiality is preserved. So prior to the interview, there will be researcher will assure that the study participants' responses are confidential and are kept secure, and it will build up the honesty and the security. And the limitations is time consuming because interviewing participants one by one, it takes some time, and a data analysis, it will be time consuming too due to the methods of the nature. And the participants, the number of interviewees naturally wouldn't be able to get the same degree of rich data as online survey data or the mass survey. The bias, participants might change their behavior while being observed during the interview, which named Hawthorne effect. And then another limitation is the subjectivity. Having a strength in understanding the experience of others, and however, it's a limitation happen if biases are not properly acknowledged and managed during the qualitative study. About the complexity, in order to finalize a theory at the end of a grounded theory study, there will be various stages of coding and analysis, which is complex and needs to be done correctly. Only the coding part consists of the several steps, such as open coding, axial coding, selective coding, and then creates a theoretical framework. The limitations, restricting study areas. So the study is not intended to cover healthcare data breach, cybersecurity, or health record data protection. These topics are another very big issue in the health sector and should be another research work. The experience about the participants have to use the computer program in their daily clinical routine. It will help to gather a more detailed information from who has experience in order to collect rich material. Geographic location, our target population are limited to involve physicians who practice medicine in the United States. The reason for delimiting the United States is finding out the computer program impact in the world leading country that uses the most expensive, latest, and the smartest technologies in the health industry. So that is all about my dissertation proposal, and I hope that it will give some very interesting results after finishing the research work. So if you have any question, please feel free to ask, and this is my contact information.
Thank you, Dr. Ganbold. I did put the link in the chat. I don't see any questions yet. Please, if you have questions, go ahead and put them in the chat for Dr. Ganbold.
Do you want me to stop sharing the screen?
No, you're fine. Go ahead and leave that up in case anyone wants that. Wants your contact information. We can leave that up for a little bit. Very interesting. I wondered, did I miss it? Did you mention about how many folks do you anticipate interviewing?
Well, the minimum number is 30, as suggested by the other qualitative one-on-one interview research work. If the more is better, but comparing to the time frame that I can finish in my dissertation, so the realistic number is 30.
Okay, thank you.